If your dentist has diagnosed gum disease, you're far from alone. Most adults experience some form of it. Gum disease is an infection of the tissues holding your teeth in place, the gums, ligaments, and jawbone. Dentists describe it in two stages: gingivitis, which is reversible, and periodontitis, which can be controlled but not fully reversed. Plaque bacteria harden into tartar. Smoking, diabetes, genetics, and stress all raise the risk of more severe disease. Dentists diagnose gum disease by measuring pocket depths with a small probe and checking bone levels on X-rays. Treatment starts with the basics: better brushing, daily cleaning between teeth, and cutting back on tobacco. For periodontitis, dentists perform scaling and root planing, a deep cleaning below the gum line under local anesthesia. Sometimes, dentists add antimicrobial rinses or targeted antibiotic gels placed inside deeper pockets that heal slowly. If deep pockets remain, a periodontist may perform flap surgery, bone grafts, or gum grafts to restore support. After treatment, tenderness and mild bleeding are common for a few days. Gums tighten visibly over 4 to 8 weeks. Maintenance visits every 3 to 4 months keep the disease from returning, a lifelong part of care. Not smoking, controlling diabetes, and daily cleaning between teeth are the strongest protectors of long-term gum health. With timely treatment and steady maintenance, most people with gum disease keep their natural teeth for life. Did you know you can get this treatment abroad at the same quality you'd get in the US or Europe for a fraction of the cost?
Ginger Healthcare is one of the world's most trusted medical travel companies. It helps patients to find safe and affordable care in India, Thailand, Turkey, Singapore, Dubai, Malaysia, and more. Visit ginger.healthcare or check the description for details.